Infant and Newborn Care. Introduction. When holding a newborn, you should do which of the following? Choose one of the following options. 1. Wash your hands. 2. Be gentle and avoid shaking the newborn. 3. Support the newborn's head and neck. 4. All of the above. Correct. Newborns are fragile and need to be held carefully. There are different concerns when diapering a baby boy than when diapering a baby girl. Select true or false. Correct. Boys may urinate when exposed to air. Girls need to be wiped from front to back to prevent urinary tract infections. Diaper rash always goes away on its own. Select true or false. Correct. Call your baby's healthcare provider if he or she has a diaper rash that gets worse or lasts longer than 3 days. Your baby may need a prescription. You should bathe your baby every day to keep him or her clean and healthy. Select true or false. Correct. Bathing babies more than 2 to 3 times a week can cause dry, sensitive skin. To show that they are hungry, infants may do which of the following? Choose one of the following options. 1. Cry. 2. Make sucking noises. 3. Put their fingers in their mouth. 4. All of the above. Correct. Infants have many ways to communicate their needs, including hunger. You should always place your baby on his or her stomach to sleep. Select true or false. Correct. The statement is false. Placing your baby on his or her back to sleep is important because it reduces the risk of SIDS. Any exam that your baby receives is considered a well baby exam. Select true or false. Correct. A well baby exam is separate from any other visit for sickness or injury. Thank you for using Explain.